Thank you so much for inviting me here to speak to you today. My name is Julia Lankus and I'm a registered nurse. The two topics that I think are most appropriate to cover will be erectile dysfunction and prostate disorders. Let's start first with erectile dysfunction. The term erectile dysfunction is broad and it includes a lot of disorders, but it basically means that an erection is difficult to obtain. To begin with, it's important to know that erections are completely and totally related to blood flow in the penis. There are small erection chambers throughout the penis that fill with blood and allow the penis to be firm during an erection. After an orgasm occurs, the blood is released out of these chambers and the penis once again becomes soft. So now that you understand a little bit more about how an erection develops, let's talk about why it doesn't. Of course, there's an age component. Men over 50 are more likely to have difficulty obtaining an erection than men under 50. However, several diseases can also affect erectile dysfunction. High blood sugar or diabetes reduces blood flow to the penis, and so does cardiovascular disease. So two of our most common diseases, diabetes and heart disease, are causing reduced blood flow within the penis. Smoking, a common problem in America, also reduces blood to the penis. Obesity, high cholesterol, and lack of exercise also play factors. Excuse me. There can, of course, be an emotional component to erectile dysfunction. I think everyone knows how stress can affect our quality of life and the quality in our sex lives. Depression, relationship issues, and general stress all affect how our body responds during sexual intercourse. In addition, probably the hardest with this is the ongoing worry about sexual performance. You can see how this will circle round and round and the stress increases. Please hear me. There is no shame in seeing a counselor and finding ways to deal with our stress. We're great, most of us anyway, about seeing a doctor for something physical, but many of us are reluctant to see a counselor for emotional issues that directly affect our health. So in this case with the stress, I highly recommend seeing a counselor to learn ways to deal with this struggle. In addition, to help with erectile dysfunction, stop smoking, reduce alcohol, and take your regular medications. If you have heart disease or diabetes, be sure that you continue with those. Know and understand and believe that you can change your health for the better by cutting down on fats, alcohol, and starting a low-impact exercise plan. So in addition to the changes that you can make, let's look at some of the common treatments. There is a vacuum device that is basically a tube that slips over the penis, and then there's a pump that places pressure on the penis and increases blood flow to the penis. Once the penis is erect, a small elastic ring is placed at the base of the penis, and this keeps the blood flow in the penis. This method is really nice in that there's no medication, so there's no side effect. And 75% of men have success with this method. So it really comes down to a matter of how comfortable you are with this method. But 75% is a fantastic achievement. 80% of men have success with medications. The most common is Viagra, but you might have also heard of Levitra or Cialis. These drugs affect how blood flows into the penis, and they allow the penis to fill and achieve an erection. The side effects are few, but they include headaches, stuffy nose, flushing, and some muscle aches at times. Of course, the ads always talk about the erection that lasts more than 4 hours, and yes, indeed, that does require emergency treatment, but it is very rare. Always let your doctor know if these medications are working for you and if you're having success with having sex again. You can expect an increased ability up to an 80% improvement by using the medications. There's also a drug called alprostadil that can be injected directly into the penis. This injection rate has an 85% success rate in achieving an erection. The needle is tiny. It's the same or similar to the ones that are used to give insulin injections if you have diabetes. This method does have a bit of a higher rate of producing erections that do last more than 4 hours, and some people experience burning with this. But an 85% success rate is pretty darn high. In addition, the same a medicated tablet can be placed directly in the penis, It's not as successful as the injection, but it still works for a lot of people who are uncomfortable with giving themselves an injection in the penis. So as a review of these treatments, you can see that all of the treatments are highly successful. We go from a 75% improvement with using the erection device up to 80% with medications and all the way to 85% with the injectable medication. So which one you choose is going to depend on your comfort level and your situation. There's also surgical options. This is not the first go-to. Many of these would be tried before you would even consider surgery. Surgery involves, there's two common ones. One is to simply place a firm device inside the penis that keeps the penis firm at all times, but yet it's still bendable so you can easily push it down when it's time to pee. But it's also always hard, so you're able to have sex when you desire. There's another kind where a pump is inserted into the body, and through this pump you are able to press fluid into the penis. The nice thing about this device is it allows you to control the firmness of the penis and is really sex on demand. When you're ready, you simply inflate the pump, which affects the penis. So this can be an excellent method for many people. So in review, we've talked a little bit about how the penis is designed to work and the impairment of blood flow that does affect erection. We reviewed some of the causes of erectile dysfunction and we covered some treatment options. Finally, we reviewed things that you need to share with your doctor for each treatment, and then we discussed lifestyle changes that can improve penis function. Any questions? If no one has any questions, let's now turn our attention to the prostate gland. We're going to talk about the two most common diseases that affect the prostate gland. We're going to briefly overview prostate cancer, and then we're going to talk a little bit more about benign prostatic hyperplasia. In common terms, benign prostatic hyperplasia simply means that the prostate is large, but it doesn't have cancer. So take a look at this chart. On our blue, that is men aged 41 to 50. Approximately 20% of them have some kind of prostate enlargement. And now take a look at the red. Red is men who are 51 to 60 years of age. 50% of them have prostate enlargement. The green is the 90% of men who are older than 80 who have an enlarged prostate. So you can see the age-related changes from the 40s all the way up to the 80s. So why does this happen? Our prostate gland is normally about the size of a walnut. It continues to grow as we age. Here's an avocado seed, so you can see the difference in size, and a prostate gland can become quite large. I love this picture from the Mayo Clinic. It is an excellent picture, and it really shows how, as the prostate gland enlarges, it's going to compress the tube that leads from the bladder all the way through the penis for when you pee. As this tube becomes compressed and the prostate enlarges, you can see how urine flow is very affected. So it doesn't take much for an enlarged prostate to slow and or interrupt urine flow. And that's the most common complaint with men with enlarged prostate glands. It can be difficult to urinate, and a lot of men have what we call nocturia, which is nighttime urination. If the enlarged gland is cancerous, there can be pain with urination, blood in the urine, and even blood in the semen, and some men experience back and hip pain if their prostate gland has cancer. But to diagnose an enlarged prostate, there's a combination of symptoms assessment, which is the frequent urination, the nighttime urination, the feeling like you can't empty, as well as a physical exam. There is a digital rectal exam, is what it's called, where the doctor inserts his or her finger into the rectum and is really looking for a prostate that is hard or lumpy in appearance. In addition, your physician might follow the PSA, which is the prostate level in the blood. So let's review treatment options for an enlarged prostate that is benign, one that does not have cancer. And this is the one, of course, that is more common. I showed you the chart with how many men struggle with this as they age. So there are several medications that help cause the prostate to contract, make it a little bit smaller in size. These meds are usually well tolerated, but they can cause dizziness, tiredness, a runny nose, and headaches. But with all medications, these side effects improve and decrease over time. You'll notice when you look at this, all of them end in OSIN. So they're very, very easy to recognize, these common medications. So back to prostate cancer. Treatment for prostate cancer can involve surgery, radiation, and even hormone therapy. However, because the prostate is so slow growing, you will find many physicians are very comfortable with a watch and wait and see. As your prostate enlarges, you may not immediately have treatment that you thought you would have. It's different than other cancers that are often quickly treated. So the watch and wait is just to see when is the best time to start treatment. So there are so many medical conditions that we have control over. For example, if you eat a fatty diet, you are likely to have plaque deposits in your vessels and develop heart and vessel disease. But an enlarged prostate is not so easily linked to anything but age-related changes. But healthy eating and exercise benefit everyone. Consider increasing your fruits and vegetables, starting a low-impact exercise plan, again, cutting down on smoking and alcohol. All of these can help increase your feeling of well-being and control over your health. So in conclusion, we reviewed what a normal prostate gland looks like and what an enlarged prostate gland can look like. We talked about the effects on urination that an enlarged prostate gland can cause. We reviewed treatment plans for both an enlarged prostate that is cancer-free, and we briefly touched upon treatments for cancer. As always, stay in touch with your doctor and share any changes with pain, urination, ability to urinate, and just your general urinary health. Are there any questions about men's health? I appreciate very much the opportunity to come and speak to you today. Thank you.